from Wave in Louisville, Kentucky. This is Listens Live.
Hello, everyone. Good afternoon to you, and thanks for joining us here on Wave Listens Live. I'm your host, Brian Schlonsky. Today, we've got a fantastic show for you as we take you right to the rundown now and show you the guests you can expect with us today on Listens Live. We will talk with lifestyle expert Annette Figueroa about the Plexiderm 10-minute challenge to shrink your under-eye bags and wrinkles from view. We'll tell you how you could try this coming up. AMP Louisville is also joining us to talk all about the AMP Business Incubator. We'll get to talk to two of the 2024 graduating class on how the program has helped them succeed. But up first here today, it is Kids Dentistry back with us to talk all about National Children's Dental Health Month. We even have some tips for fostering healthy teeth and gums from a young age. As we bring you here into the studio, Dr. Brent Hurst, a pediatric dentist with Kids Dentistry, joining us here. You've made it all decorated perfectly for us, so it's good to have you back on the program.
Absolutely. Thank you for having me back again, too. I had a wonderful time last year, and I'm glad you had me back again this year, too.
Let's talk, because this is clearly an important topic. We've got a lot of parents who watch the program. So when we talk about February specifically, it's a special month in your world.
It sure is, too. February is National Children's Dental Health Month. So this is a month that we strive to make sure we educate our parents and our children on proper brushing habits, techniques, and the proper diet and hygiene instructions as well. For instance, I even went to my kids' school this morning and talked to the kindergarten to the 5th graders about all things dentistry, too. So they had a great time. Well, I hope they had a great time, too. And made sure I ended with a bang, too, and did a little juggling performance for them as well.
Of course, I remember that well. Why is this something that's so important to get the message in front of kids at as early an age as you can?
Well, if you can imagine, we have 20 baby teeth, and we end up having 32 permanent teeth. That's 52 teeth you have to take care of for the remainder of your life. If you don't take care of them at an early age, those habits continue on as you become a teenager and an adult, too. So you don't want to lose your teeth as an adult, so the better you take care of them now, the parents are educated. If the parents are educated, the transition to the child becomes much better, too, and that education just follows them for the remainder of their life, too. So.
When we're talking about tips, especially for parents out there, we mentioned that obviously as early of an age as possible is a good idea to get your kids brushing and get these healthy habits in place. But it's not always easy when you have young toddlers. So any tips for the parents out there?
Yes, of course. So around, we usually recommend the child sees a dentist by the age of 12 months old or the time the first tooth comes in. So anytime you see the teeth come in, you can come and see us, too. We'll do an evaluation of the gum tissues. We can evaluate lip tie and tongue ties. Those have issues with regards to latching during breastfeeding, and then also sometimes speech as well. And it also sometimes will help cause plaque or calculus buildup on the teeth, and it can eventually cause cavities as well. So it's good to see them at an early age, and sometimes the little ones aren't as excited as us to see them too, but we tend to make it a fun appointment for everybody. So
I was going to say, you always, we talked about juggling, and you've brought some of the things with you here today, but how are you able to make kids at a young age comfortable and make this an experience where they look forward to going to the dentist because they know it's a positive thing in their life?
Yes, so as we know, to most people, going to the dentist can, it's like getting a root canal done. Well, we've heard of that term before, too. Well, for instance, I tend to just try to make sure I kind of calm my voice down to the child's level. I try not to be super exaggerated all the time. Some of my patients like that. I wear light-up shoes every day, so I got my light-up shoes on today, too. And I wear goofy animal ears today. Got my frog eyes on today. But I tend to wear something fun to make sure they don't, aren't super intimidated by me. Because you can imagine if you're a child in the dental office, if you got somebody wearing a mask, they got their glasses on, their loops, and they're looking down at your face, at your teeth. It's intimidating for a lot of kids, too. So if you make it a little bit enjoyable, a little bit fun, they tend to respond better and have more of a smile. And you got to have a smile every day, too. So I got to wake up with a smile just like you. So
when we're talking about starting these healthy habits, and we know that kids sometimes, they watch their parents do something and then think, okay, now I want to try it. Brushing is a great example. Is there an age estimate for when they should start doing this themselves?
That's a great question too, and a lot of parents will ask that. I tend to recommend usually close by the age of 8. So
Okay.
before the age of 8, most kids' hand skills haven't developed very well. So they're not able to really get the dexterity in the certain areas of the mouth too. So most kids around that age tend to get cavities on their back teeth because they're not brushing super good back there. So we want the parents to help guide them and help even brush their teeth up until the age of about 7 or so. Around 8 or 9, the kids can have more independence brushing those teeth too. And we know 8 and 9-year-olds they're already independent anyway too. So giving them that responsibility is more of a good thing in the long run. But we know kids that are high rate of cavities, we still want those parents to really stay on them too. So.
Is there a message that you have, because you mentioned that was a question you get a lot. You probably have parents come to you and say, okay, if my kids are young and still have their baby teeth, they're going to lose them anyways. Why do I need to be on top of this? It is still important, no matter, you said about 12 months, they're getting teeth in, you should be on top of their dental hygiene.
Of course they are too. A lot of parents, I've had that, several parents tell me before, their baby teeth, you're going to lose these teeth, right? Well, most kids don't lose their baby teeth between the ages of 6 to 12. So if the cavities start while they're young, cavities start out small, but they can grow big. We see tons of children that get abscess or infected teeth. You get abscess infected teeth, you have to remove those teeth or pull the teeth. Not an easy procedure to put a child through too. So if we start at an early age with those good education there too and educating the parents and the child, we can help prevent those episodes from happening as they get older as well.
Is there a recommended, when we're talking children specifically, how many times a day, that type of thing when we're at home, we've got the kids' dentistry on the calendar for you guys to do the professional cleanings, but how often should we be on this as parents at home?
So Dr. Brent, myself, always say I'll have the rules of 2.
Okay.
So that means we have brushing 2 times a day for 2 minutes and go to your dentist twice a year too. If you do those things, you can help prevent those cavities in the long run. But don't forget about flossing. I tell parents all the time, between the ages of about 3 years old to about 9 or so, some of the most common areas we see cavities are between the teeth because we neglect the flossing. And the flossing can cause bad breath as well. We know kids don't want to have bad breath as
course.
So especially the girlfriends and boyfriends going on. So incorporating the flossing too and brushing that tongue, that's where the bad odors come from as well.
Let's talk. We've got about 90 seconds left. Best way to book an appointment and how you want parents to go about that. Anything that if they're making their very first appointment with you that they need to make sure to bring with them.
Sure. KidsDentistry.com is a great way to make a visit to our offices there. We have tons of offices around the community to provide excellent care to our children, special needs patients. We don't just treat children. We treat all different types of ages of patients that have certain sensory issues, certain sorts of health issues and medical conditions that just other offices won't be able to offer there too. So we're able to get that taken care of for them as well. And other than that, you know, KidsDentistry.com is the best place to go.
We've got that pulled up on the screen right there. There's also a phone number. If you have been putting this off, here is your reminder, parents, to make sure that your kids get in, especially if they are young and haven't gotten to do so. Kids Dentistry, a great place to go. Okay, less than a minute left. I can't see what's on the other side of the dog. You juggling today? What do you have
as well
today?
there too.
Let's
so,
do it.
Occasionally I'll tell kids in the office there that if they're really scared, sometimes I'll blow them up a little glove balloon too, or try to sing them a little Disney song. Sometimes it just doesn't calm them down, but occasionally I'll say like, hey, Dr. Brent can juggle. So it kind of shows a little hand skills too. So I'll do a little bit of juggling performance for you. I learned this in middle school at Mazik Middle School here in Louisville, Kentucky.
Right down the road.
Yeah, we had a juggling team when I was younger. We got to do performances around the schools around town and kind of blinded by the lights here, so semi-retired, of course.
Oh yeah, it's a better job than I could do. Well, Dr. Brent,
do 2 in 1 hand.
Thank you for your juggling skills.
Absolutely.
For your knowledge on dentistry, and thanks for being here today.
Absolutely, I had a fantastic time again too. Appreciate it.
All right, well, stay with us here on Wave Listens Live. 2 more great segments to go. Coming up next, we are talking the Plexiderm 10-minute challenge to shrink your under-eye bags and wrinkles from view. Doing that with lifestyle expert Annette Figueroa. Next.
The Wave Charlie Wilson's Jen Air Kitchen is furnished by Miller's Fancy Bath and Kitchen, Kentuckiana Countertops, and Annabelle's Oriental Rugs. Thanks to these great sponsors.
Celebrating the good news in your community.
It made me feel so happy.
That's Positively Wave, brought to you by Ivy Tech Community College.
If you've been in an accident or had an injury, we got your back, and that's a fact. Your consultation's free. 800-800-4600. 800-800-4600. Get used in Coleman and get it done.
Are you getting all you want out of life? Suffering from poor health or financial issues? I've been there. I'm Paula Swope from the Thought Snob podcast. If you're ready to create the path you've always wanted, check out my book or download the Thought Snob podcast today.
It's about time.
I had a true partner in my health.